The Center for Clinical Bioethics was founded by Dr. Edmund Pellegrino in 1990 when Milton Korn, who was the dean of the medical school, wanted a presence in the medical center. As many people know, at Georgetown we're fortunate to have the Kennedy Institute for Ethics. But Dr. Korn wanted a presence in the medical center. And so what the center does, we're responsible for the required ethics curriculum, and we created an interdisciplinary ethics curriculum for our medical students and advanced practice nurses. And the objective there was, we experience the challenges together in the clinical arena, why not study them together? Why not talk with one another? So we do ethics education, not only of our students, but ethics education within the broader hospital community. So we do orientation for new employees, we do medical rounds, we do sessions with residents, we do grand rounds. But we also serve as members of the Hospital Ethics Committee, the institutional review boards. There's a special Catholic committee to look at some of the issues that come out of the ethical and religious directives for Catholic healthcare facilities. So there's a presence, trying to be available to people from the administration of the hospital, the administration of the medical school. Sometimes it's an education question. We had an interesting scenario about one of the graduate students, and the faculty weren't sure what an ethically good response would look like, and just pulled in, you know, can we talk about this? And then, because we're in Georgetown, we don't want to only serve our folks, although that's our primary focus. We also, through our research and scholarship and speaking elsewhere, want to take our experience and reflection to broader communities. Last year, we published a book that came out of a symposium on trying to articulate a theological anthropology for bioethics. And it was great to commission people to work on chapters, to come together for 2 days, to dialogue, to go back, refine the chapters, and then to put a book out there that will hopefully make that experience accessible to others. Right now we're working on a similar project, and this one will be on the crisis of the healing professions. So that's I think one of the things that probably is most exciting about being here is the moral community within the center itself. And what many of our visiting scholars and researchers talk about is the value of being part of that moral community, so that part of the experience of being here isn't only learning how to do an ethics consult or how to teach a class, but to be part of a group of people who care about things and talk with one another and challenge one another